Hey everybody, and welcome back to the channel. In today's video, we're going to be going over Blueberry's recent health journey. She had surgery to remove an infected cyst on her leg, and we'll walk you through her journey from how we treated it to her recovery process. This was a very stressful experience for us that lasted a few months, but we wanted to share our story now in the hopes that it could help someone else going through something similar in the future. Before we begin, I just want to give a quick disclaimer that some of the images of the cyst shown in this video could be distressing for some viewers. In late October, we noticed a few small bumps on Blueberry's right hind leg. She wasn't showing any odd symptoms. She was eating, pooping, and acting completely like herself. I only happened to find the bumps when grooming her, which is why it's so important to regularly check your bunny closely. Since we weren't sure what they were or how she got them, we called the vet, and luckily they were able to fit her in the next day. After an exam, the vet believed the bumps were likely dermal cysts. While a biopsy would be needed to confirm this with certainty, they recommended we start with a once-daily treatment using a topical cream called Flamazine. We were really hopeful the cyst would clear up with just the cream, since the next step would likely involve sedation for a biopsy, which would be much more invasive. At first, the area seemed to improve, but after about 2 weeks of treatment, we noticed the cysts were beginning to look worse. This could have been from her licking the area since it was bothering her. We did try using a cone to prevent her from licking, but she absolutely hated it, so instead I would just give her a lot of head pets after applying the cream to distract her from licking it off. We continued to use the Flamazine cream, but unfortunately the cysts continued to worsen and I was worried they were starting to look infected, so I brought her back to the vet. At this vet visit, she was prescribed oral antibiotics, 0.32 milliliters of azithromycin, along with pain medication. Blueberry has a very sensitive stomach and is prone to GI stasis. Unfortunately, since some oral medications can upset a rabbit's digestive system, she did go into stasis while on azithromycin. I was able to help her feel better at home by using Metacam and by following our usual GI stasis care routine. If you're a rabbit owner and not familiar with GI stasis, I definitely recommend checking out our in-depth video later, where we walk through the signs and symptoms and how to treat it. I'll link it above. Since she did not respond well to azithromycin, our vet recommended switching her to a different antibiotic. She was then prescribed 0.07 milliliters of sulfatrim twice a day, which she tolerated much better. We found that by giving Blueberry critical care before her antibiotics helped to coat her stomach and make things a bit gentler on her sensitive digestive system. We supplemented with about 5 to 10 milliliters of critical care during her antibiotic doses. To administer critical care, I hold her nice and close so she feels secure. Then I place the syringe in the gap behind her front teeth. I slowly dispense it so she has time to chew and swallow. She was on sulfatrim antibiotic for 2 weeks, and after each dose we gave her a few syringes of water to help wash away the taste and make sure she was hydrated. In addition to the antibiotics, we were giving Blueberry 0.7 milliliters of Metacam twice a day to help manage her pain. She actually loves the taste of Metacam and happily licks it up on her own, so we don't need to force feed it. Afterwards, she would normally nap, and you can tell the medication helps her to feel more comfortable. We continued to monitor the cyst closely each day. While the outside of her legs started to look better, there was still a firm lump under the skin that was clearly painful when touched. Since it had been over 4 weeks without fully resolving, we decided to move forward with a biopsy to get a definitive diagnosis, which would help the vet determine the best next steps to make her feel better. It had been a really long few weeks. I felt awful knowing she was uncomfortable and stressed that we had tried a few different approaches and her leg was still not healing well. Through it all, she was such a trooper with every appointment and handled the long car rides to the vet so well. We had the car all set up so she can go from the litter box to her stump, full passenger princess setup. I like to hand feed her as much hay as she will eat in the car to keep her digestive system moving on long journeys. Blueberry loves hopping up right onto the seat at the vet. She really is quite the character. After her exam, they took her back for the biopsy. Luckily, because our vet is so amazing and with the help of some treats, they were able to take a biopsy without needing any sedation. This is what her leg looked like after the biopsy. The sample was then sent off to the lab for a pathologist to examine. Our vet instructed us to clean her leg using Pro-Hex 4 wipes. These wipes provide antiseptic, antibacterial, and antifungal support to help ensure the spot where they took the biopsy is healing properly. After cleaning the area with the wipes, we were instructed to continue applying Flamazine cream. To make sure it had time to properly absorb and do its job, we kept her in air gel. We would keep her on the counter for a little bit afterwards and give her lots of pets and attention so she wouldn't be tempted to lick off the cream. The histopathology results came in about a week after the biopsy and showed that the lump was an infundibular cyst, which is a benign, non-cancerous type of cyst. The culture also came back with no bacterial growth, which was really reassuring and suggested that the infection had likely already been cleared with antibiotics. Even though the cyst wasn't cancerous, these types of cysts can continue to come back or cause discomfort if they are not fully removed. Because of that, our vet recommended surgically removing the affected area as the best next step. The week leading up to her surgery was really nerve-wracking. It wasn't an easy decision. I was so anxious about putting Blueberry under anesthesia. She is truly my best friend and we love her so much. Surgery on small animals like rabbits always comes with risks, but we knew she was in the best hands with our trusted rabbit-savvy vet. They always take such amazing care of Blueberry and we're truly so grateful for that. She did incredibly well during surgery, and they were able to fully remove the infected cyst. Everything went smoothly, and we couldn't be more thankful for our veterinary team. I felt such a wave of relief when we got the call that she had woken up from anesthesia and was already nibbling on hay. They said she was also trying to eat through her IV line. Even though she's not feeling the best, she's still got that spunky personality. On the drive home, she was pretty groggy from the anesthesia and just wanted lots of pets, so of course we gave her all the love. When we got home from the vet, she was really sleepy. But by the next day, she was already excited to eat her veggies, which was such a great sign. This is what her leg looked like after surgery. We had the procedure done just before Christmas, and her fur actually started growing back really quickly, which made us so happy to see. Her leg was already looking so much better. She was on Medicam for pain management for 3 weeks while she healed. During recovery, we had to limit her movement to make sure everything healed properly. We set up an X-pen around the couch to stop her from trying to jump up. It wasn't easy keeping her from jumping, especially since she was starting to feel so much better. But slow, steady healing was really important. She really started to act like herself again. She loves the Christmas tree, so seeing her do binkies under it like she always does really warmed my heart. It truly felt like the best Christmas gift, watching her heal and return to her happy, healthy, hoppy self. Unfortunately, Blueberry has had her fair share of medical challenges. We wanted to share her story because this experience was a huge learning opportunity for us, and we hope this video might help someone else going through something similar. A huge thank you to all the incredible vets who helped take care of Blueberry. We're so grateful for everything you do and all the love and support that you show her. A reminder that rabbits are considered exotic animals and can have complex health needs that require specialized veterinary care. From daily medications and critical care feedings to stressful surgeries and recoveries, it's not always easy. While I love sharing the fun side of having a bunny, I think it's just as important to talk about this side too. If you ever notice anything unusual with your bunny, even if they seem totally fine, it's always worth getting it checked out by your vet. I'm so thankful she's feeling better and her leg has healed. Thank you so much for watching and for always supporting Blueberry. See you next time!